Hi, it's Christine. It's the week before Thanksgiving. I just want to do an update. I haven't done one in a long time. Things are getting really hard. Starting last summer, I've been training people pretty much all the time. I paid like almost $1,200 in June, and I think I've been struggling with training a person that doesn't have very good English comprehension, and that's still been a little bit of a struggle. And I haven't been going to the doctor. I've been to the hospital probably 10 times this year. Probably trained 15 people. Sometimes with help, sometimes by myself. And starting October 31st, it got really busy for me because my doctor that I've had for 10 years, my internal medicine doctor, is leaving, and she got promoted to director of senior care services over at Valley Medical. So she's leaving in March to go to out of the University of Washington. I have not had great experiences at the University of Washington in the emergency room, and I did go to a couple eye appointments, so I was able to get to the doctor a couple of times with some of my old caregivers. And I've been seeing for my eyes for 33 years. And so everybody gets referred to the Eye Institute now. It's at Harborview. And was treated very badly, and I was just wondering if there's like some sort of red flag they put, because I've been in the emergency room for several different things, and a lot of times because I have a genetic disease, or like this summer I went 5 months without a bowel program. They just don't want to help. They actually were rude to me. And in August I had a psychiatric evaluation because I've been on palliative care for a year, and I have situational stress. I will, on any psychological, neurological questionnaire, I will get a depression rating, but it's situational. I'm a happy person. Otherwise, it's just been overwhelming with my caregivers. My high needs is really difficult to get good people, and they're sending me people that are brand new that I have to train to be literally rehab therapists. And then after they're trained, then they have to go to 75 hours of training for the state, and a lot of times they're not even passing their state exam. They have like 120 days to finish their training. So a lot of people are pushing their training off, and which means that they're milking the time they have, and in the meantime, I'd have to train more people. And then the state test is even got more time out, so a lot of times people are taking training classes, they pass them, they have skills in a written test, and then they have to be tested by the state. Well, by the time they're scheduled to be tested with the state, a lot of them move on, or they don't want to, they've lost a lot of their memory on the topics they need to study, so they have anxiety because they don't feel like they're ready to be state tested, because the state test is really, you have to study for it. And so in the meantime, I did my last update in September, and I probably repeated a few things from the summer in that update, but at the end of October, I turned 50, October 7th, which sucked. Just didn't really have a great birthday, but starting the end of October, Halloween, I got a letter saying that the University of Washington was no longer taking my insurance. So I had to work with the broker to find a new insurance plan, and I wanted to make sure that my wheelchair vendor took the same insurance. And it's a long time. You have to go through a lot of, you have to work with the agent for quite some time to get signed up. And then I found out that my wheelchair representative doesn't take the insurance that they offered me, and that really stressed me out, because I really like my wheelchair representative, and if something goes out, like a motor or whatever, they will pick up my chair. They'll come to my house. Otherwise, I have to go to North Seattle, and it's just very difficult. The other wheel representative lives closer in Fife, so they often come to my house. So coordinating all this was just very stressful. And then I got that letter about my doctor leaving, and probably starting after that psychiatric evaluation, I started having nightmares, really vivid dreams and nightmares. And really, I don't think I've fallen into a deep sleep for a long time. I have had a sleep disorder because, I basically work with caregivers. I have 5 caregivers, so I don't really get a break, and my muscles are so horrible that even if I did want to take a break, I have to stay on the routine because of hydration, eating, going to the bathroom, all of the above. Well, the good news is I got help with someone to do my bowel program, and he's often helped with training. This all kind of came about in later October. But I had one caregiver suspended because she didn't schedule her state test. So I've gone like 5 or 6 weeks with having new people on Sundays. I am the last 3 weeks. I've had the same caregiver, and last week was the first weekend we worked together, where we were just by ourselves and just doing the Hoyer lift back in and out of bed, and putting me in diapers so I can rest, It literally took her an hour to get me in and out. It's not the easiest thing to catch on to, but that it just tires me because I'm talking. So to get back to these nightmares, I pretty much started having consistent deep sleep because instead of, I sit in this chair, in the commode chair, almost all the time now because of my temporary people or people are not trained. And my other chair is pretty complicated, but I went to the emergency room 2 weeks ago because I had another really, really bad nightmare, and usually I just take a diazepam and my heart races and I start short of breath, and it usually subsides, but it didn't this time, probably because I was fucking busy. Me and my caregiver that was covering, I had a caregiver go into training for 3 weeks November 1st, so the person that was covering her is experienced. We worked together before. She's 59 years old though, so she's not a spring chicken or anything, but we have so much in common. She's really smart. Anyway, we have, during the week, the phone rings off the hook, the emails and the forms coordinating. After a while, I switched to another insurance company that my wheelchair representative would take, but I was not getting any medical cards for them, so I threw away a lot of the mail, and it turned out after a while I had some prescriptions to fill, and everything was supposed to be activated November 1st. So just lots of phone calls trying to find out where I stand on my insurance, find out where my cards are, and just a lot of work, plus training, plus nightmares, plus emotional people, caregivers going through their own personal stuff. So when I got to see my neurologist after the emergency room, they just checked for a blood clot, because people sedentary like myself that have chest pain, and it was more on my lung side, they looked for blood clots, and I got literally 3 hours of sleep that night. The next day I had to go to the neurologist, and I'm not used to going to the doctor because I went to those eye appointments this summer, but I got really the bus was delayed, but the good news is my neurologist I've been seeing for 26 years. So he was able to identify the problem a little bit more. He wants me to see a special psychiatrist that helps with sleep, post-traumatic stress disorder, which I'm sure I have had, but it was basically not surfaced for so long, and so we didn't know if that's why I'm having the nightmares, or I think he called it hypoxic, and that's where my lungs, because I'm doing so much talking and getting short of breath, plus the nightmares. That's a sign of my disease progressing to where my lung capacity is limited and the blood supply going to my heart is weak and compromised. So this psychiatrist lady will be able to help evaluate what exactly I'm having these dreams and nightmares for, and to see if that is my problem with the breathing, because they can put something on your finger that measures your oxygen. So I've been basically just working. And yeah, it's been hard. I've not had my hair done since April. I went 10 days without a shower. I look terrible. When you feel clean and you look better, it makes you feel better. Well, I usually start running out of gas about 1:30. I need to lay down, so my fatigue has gotten worse. My vision is, they said that I have dry eyes, and in April, ever since April, my vision shakes when I look side to side. So my neurologist explained to me that no matter they did MRIs, no matter what tests they take, x-rays, CTs, MRIs, they're not going to be able to see the progression of my disease, because it's cellular. It's all muscle. And so I've been very, very tense and uncomfortable, especially sitting in this chair. And sometimes when I'm training people, I literally have to sit in this chair all day without a break, because I can't possibly train him to, I have really by the time they get me out of bed, it's sometimes 11:30, and I have to start getting ready for bed, especially with a new person, by 4:30 or 5 at the latest. So the challenges are just incredible, but my neurologist still believes I should remain in my home. I would not do well with moving, because my house is so accommodating, and believe it or not, I'm still working some, but it still makes me eligible for Medicaid, so my finances are okay. They're good. And so he told me that he doesn't recommend I go into a nursing facility, which so many times, mentally I just feel like giving up, because I'm so tired and angry that I'm having to go through this progression and dealing with everything I explained. So anyway, I'm hopeful. I'm buying Thanksgiving dinner for everybody, my caregivers, next week, because last year my holidays sucked. I bought a Christmas tree to try to make the holidays better, and I have a lot of doctor appointments starting in December, and I'm just praying to God that one of my caregivers comes back so she can take me to the doctor, because she's worked with me for years. Otherwise, the only other person that can take me to the doctor just works Friday, day shift. Otherwise, he's on night shift. they've been putting me with people that are scared. I don't blame them. They walk into the situation, they do not know what they're walking into. A lot of them have to work the next day. People get tired because they're working 2 jobs. The system makes me angry, and that's why I've always wanted to be a voice. But literally, I think I've kind of given up on that because really I need to take care of myself now. Anyway, I had a nurse, her name is Beatrice, and I want to make a tribute to her because she did my bowel program for 1.5 years. She did not miss a day. She was like a mother to me. She got sick about 1 year ago with a cough, and even though she's a nurse, she would only drink tea. She was from Kenya. Sometimes they don't like medicine, doctors. Everybody got sick. I even got the flu last year, and I amazingly recover from everything. I got a staph infection in my body, and that can be so serious. I amazingly just recover beautifully. So, there's been some things that happened where could have been turned out a lot worse. But back to Nurse Beatrice. She left in April. She still was sick. I finally got her to, baby try Mucinex. That was, I'm not sure how long into her sickness, but she was sick for like 6 months. Then she finally went to the doctor. They thought she had pneumonia at first. And then they found a pulmonary embolism, which is kind of like a blood clot in your lung, but it was not the kind that travels to your heart. And then she just went downhill. She didn't work, because she works at a nursing home. And she helps me, but she couldn't work. She couldn't hardly talk on the phone to me, which she always would. She loved me like a daughter. And she just went downhill fast. Then when I would talk to her, she really would not be able to talk to me very long. She told me that they didn't know what was wrong with her. And then I just got a letter from her boss, an RN, that she had cancer. And she wanted to go back home to Kenya, and the doctor finally released her to go back home with her family on the 10th of November, last week. She died on the 12th of November. So she got to be home for 2 days. And apparently she wanted Nurse Julie to tell me that she thinks about me often, and she spoke those words, and Julie wrote me a letter, and I can't tell you how hard I'm grieving. It's hard when you lose somebody that kind of dies quick, but then people like me that are suffering tremendously, and God knows how long I'm gonna have to be like this. But my doctor said that I need to go to the psychiatrist so I can die in my home, like my wishes were, and I explained those earlier. But I'm just gonna try to make the best of the holidays, and I'm not planning on going anywhere anytime soon. Just gotta get through training people. I gotta train another person tomorrow. My caregivers are sick. Just everything that happened this week. There was nightmares and caregiver problems. It's just very hard. So that's an update. No, it's not very good, but hopefully when I get a shower next, maybe next week or after Thanksgiving, I'll be able to give it. My schedule should be better, and I'll be able to give a better update. But I just wanted to wish everybody happy Thanksgiving, and please just keep pushing forward. I know a lot of young people have a lot of abilities, and I'm a very rare small percentage of people that end up like me. So please don't be scared. I just need a support group just like you do, and appreciate you listening to my update. Hope it works out. Bye.